Good morning. Hello to everyone. First, I would like to thank you for giving me this opportunity to tell you about the PADRIS program for data analytics, which is quite an important tool to improve our healthcare system here in Catalonia. Let me begin. The PADRIS program has been run by this agency for the healthcare quality assessment of the healthcare system in Catalonia, an agency set up 25 years ago with a goal to assess healthcare technology that was supposed to be included in the portfolio of services. The agency has been developed for 25 years, adjusting to all new challenges for the healthcare system. And our mission right now is to create knowledge through assessment, through traditional scientific evidence, but improving it with the data on our system to improve decision making and ultimately the sustainability of our system and to improve the quality of our citizens. The values, I don't know what's happening here. The values of our agency that define our work are rigor from scientific research, transparency in open data, and to divulge indicators throughout the whole system, commitment, engagement with our challenges, collaboration with different organizations and ministries of the Catalan government, and impartiality, being an objective agency offering recommendations for decision making. Here's the portfolio of roles for the system, and I would like to underscore, given that we're going to be talking about data analytics for the PADRIS program, we also have the role to assess research and the social impact of such research in our system. I'd like to say that we also have a transparency program with benchmarking indicators of the healthcare system, which is published on our web, which is what we do to offer transparency. Amongst many other roles, we need to give more visibility to the sector as a reference for the sector. AQuAS can help us from that point of view work at the European level and with international projects. PADRIS was first set up in 2016 as a program to facilitate research, assessment and innovation in the healthcare sector by reusing the data in our system that Catalonia generates. Pseudo-anonymized, obviously. When we talk about reusing data, we mean that we want to increase this capability to analyze, assess, and make decisions, improving the quality of our healthcare, dynamizing this R&D and I, understanding that these are pseudo-anonymized data. And obviously, Catalonia wants to become an international pioneer in the area of biomedic and health science field. What is PADRIS? Ever since 2016, these are the ethical principles that have guided us: respect for people, solidarity, society, transparency, responsible research, and protecting data. Our goals were to improve the ability to research as well as the healthcare processes and redefine them, and finally, ultimately, people's health. Then we have custodian bodies that allow us to ensure that these ethical principles are fulfilled. We have the governing body of the agency, the board of administration. There are different ethical committees that ensure that when there's a data request at AQuAS, all of these principles from the research ethical committee are fulfilled with. There's an advisory committee, a monitoring committee, so a whole structure in place to make this sure. And then the sites that request data, they can be researchers from the accredited research centers from CERCA. We have the healthcare system agents, the public or not-for-profit research centers, and researchers from all master plans from our government. When we speak about PADRIS, we mean this is a very all-encompassing process that includes big data and AI, as we will see in a minute. Whenever we receive a study, we need to understand what the goal is and what's the approach from the research team, wherever they are. We apply a set of criteria to prioritize this project. Sometimes we get a lot of projects, and these criteria are in line with an excellency criteria with the master healthcare plan, as well as calls for competitive fund subsidies. Once we have the cohort, we've analyzed the project, we analyze the risk of this indirect identification. Once the consolidated data are extracted, when we speak about smaller cohorts, whenever there's a certain bias because of gender or any other factor, we also deal with this risk, and then we pseudo-anonymize the data so that researchers can move forward. Now, this program was set up in 2016, as I said, and in this past few years, as you can see here, this is the portfolio of areas where we've been working specifically, but mostly dealing with the blood system, the vascular and brain system, but also public health, environmental health, oncology, and healthcare management.
The data collecting organizations, the centers that ask for data to conduct their studies are mainly public universities, CISCAT system, the Circa Center, the Catalonia Health System. These network and ecosystem has helped the learning and working together to improve step by step in recent years the whole methodology and the innovative learning as to machine learning and deep learning. Some examples which have had quite an impact at the societal level. We've heard the minister from Taiwan about the pandemic management. Well, data have been key since March last year. We've had to work very hard to have real-time data, or as much real-time as possible, to try and help research. Here we have a pediatric cohort study that was conducted about the COVID. And if we go back to last year, to decide whether schools had to remain open or not, well, that helps the decision-making process. Some other studies, not only COVID focus, but stroke, and when we talk about social and economic inequality as well, there are populational studies with big data that help the decision-making, the characteristics of patients treated with CPAP and all the chronic diseases that will be a challenge in the future, or a study on 78 autoimmune conditions prevalence in Catalonia. Well, these are only a bunch of examples. If we look into the topic further, talking about complexity of these cohorts and analysis, the pediatric COVID study in Catalonia was planned to determine the epidemiological characteristics, the risk factors, vaccination status, clinical manifestations of children infected with COVID in Catalonia. And here you have, broadly speaking, what it means to prepare the data and the cohort. We have 61 data sets, which points out the complexity of putting together registries and databases to end up having the adequate cohort for researchers to be able to conduct the study according to their hypothesis. It's very important to be pioneers and be able to contribute with the right data for research. But it's as important to disseminate this, to disseminate and communicate about PADRIS and the impact that it has had in our country. And that's why we see communication campaigns and actions. It's important to have updated information on the AQuAS website and all the active channels, social media, Twitter, LinkedIn, so that the whole industry, all sectors, the citizenship, organizations should be aware of how important disseminating data and giving data to researchers is very important and can have a significant impact on research. And of course, in the coming years, we have to give a response to the already mentioned challenges. And we see a thrive of research and innovation. It's being bolstered, but also these analyses of AI data and big data. These allows us to develop predictive methods and models to help us in the decision-making process. That was very relevant in the first and second and third wave of the COVID, and what lies ahead in the coming months to reorganize, plan health systems. That's key for planners when they ask for data from us to plan, for example, mental health. In the coming year, what has happened in mental health in the last year. So we work with cohorts and data to support the health system and be up to the challenge. Thank you very much. Thank you.